Portions of this episode contain strong and offensive language. It may not be suitable for all listeners.
Back up! Back up! I'm back!
This is Williamson County, Tennessee, and the crowd is chanting at local school board members. Angry adults yell, "We will not comply," and "We will find you," at board members as they walk to their cars after a meeting.
We know who you are!
You might think the board members are talking about a controversial topic like sex education or critical race theory. Instead, for many schools across the country, the controversy is over masks.
You will never be allowed in public again!
Last fall, when some children were too young for a COVID-19 vaccination, the Williamson School Board approved a mask mandate for elementary classrooms. And when they passed the vote, many people at the board meeting booed. Members of the board talked about the conflict and the stress that it caused.
I mean, this is intimidating, y'all. I didn't sign up for this when I ran for the school board. I didn't sign up to make it.
Mask and vaccine mandates continue to trigger us and them divides in our country. The atmosphere is sometimes tense, and it doesn't seem to be letting up. Today, we'll hear from people about the decisions they've made and how those choices have affected some of our most local forms of government. From West Virginia Public Broadcasting and PRX, this is Us and Them, the show that tells the stories about the things that divide us. I'm Trey Kay.
In 1 mile, keep left onto State Route 22.
So, here I am in Mickey, Tennessee, and I'm driving to see my old friend Alice Moore, who I think the first time that I met her was about 13 and a half, going on 14 years ago.
Keep left onto State Route 22.
She was from the textbook controversy in Kanawha County, West Virginia. She was the person who kicked it off. And in many ways, she has been one of the people who has kind of set me down this road of looking at the culture wars and the differences between people. And so when I was doing some traveling here in Tennessee, I just thought that I'd route a trip to see her.
The destination is on your left.
I pick up Alice at her house and we head to lunch. It's been a while since we visited and we have a lot to catch up on. I tell her about a road trip I took last fall. I traveled to some of the southern states talking to people about our country's racial divide and to hear about people's views on masks and vaccinations. Alice is immune compromised, and so I want to make sure that I'm taking proper precautions around her. We're both vaccinated, but I wonder out loud with Alice, should I wear a mask? Do I need to? I'm trying to be careful. You tell me what I'm supposed to do.
I don't know, because I don't believe a word they're saying now. So many things have changed.
That's something I've heard from some people. They don't believe information about the virus or the vaccinations. Alice is vaccinated, but she says she will not get a third dose as a booster shot. Medical experts recommend a booster to enhance resistance to the virus. However, as public health guidelines have changed, trust in our government's ability to protect us has eroded. When we recorded this episode, the CDC had approved Pfizer's COVID vaccines for children as young as 5 years old. The administering of the vaccine to young children and teens has become a point of contention across the country. And many elected local leaders say that the decisions they've made in the interest of public health put a target on their back. The National League of Cities says 81% of local government leaders it surveyed have been harassed, threatened, or experienced violence in recent years. The survey shows that extreme polarization in our society and the spread of mis- and disinformation are two reasons for this uptick in violence. One of the things that Alice and I talked about was the controversy that's played out recently in Tennessee. At the center of it all, Dr. Michelle Fiscus. She's experienced much of the pushback in the form of threats and harassment firsthand. Dr. Fiscus was the former medical director of the state's vaccine and immunization programs.
I'm a board-certified pediatrician by training, and so I had a small private practice in the suburbs of Nashville for about 17 years, and then 2 years ago, about almost 2.5 years ago, had moved to the immunization program.
Dr. Fiscus says even when the COVID-19 pandemic first hit in Tennessee, it wasn't easy to get people to wear masks.
We were getting some pushback. Where I think we were most frustrated was in the pushback that we got from our elected leaders, where other states were putting in mask mandates and shutting things down. We advocated very hard to the governor's office to have a statewide mask mandate. We were one of the few states that did not put one in place. There was a 2-week shutdown across Tennessee of businesses and gatherings and things, and then after that, really it was just our large metro areas that are not under the control so much of the governor's office that continued those mandates. We saw a lot of relaxing of the mitigation strategies across the state. And then when the vaccines rolled out, right at first, we had such a small amount of vaccine to give to people that the lines were crazy. And, there was vaccine tourism. They were going all across the state to tiny little counties to try to get vaccines that were available. And then once those first eager people, had gotten vaccinated, then we really just saw a cliff where the interest in getting vaccinated just, really dropped off.
Vaccination hesitancy was not new to Dr. Fiscus. Her career as a pediatrician gave her lots of experience dealing with concerned parents. However, now she says it seems that parents have a different reason for refusing a vaccine for their children.
We're used to talking about science. We're used to listening to people's concerns and sharing with them what we know about the safety and efficacy and importance of vaccines. But what we didn't have a response to was, I'm not going to get vaccinated because if I do, it somehow placates the left part of the political spectrum. That we did not have a response to.
Did you have anyone in any big way, either for you personally or for the department? Was anybody complaining about how it was that the state public health department was managing the approach to COVID?
I don't feel like the department through any of this was, really at the reins of this response. It very much was doing what the governor and his COVID-19 Unified Command Group told it to do. And so Department of Health was at the table and they were presenting information. Eventually I was at the table presenting statistics and information. But, it was much more of a, well, we'll take that under consideration kind of approach. And so, not only in the public, but within the Department of Health, there was a lot of disappointment and angst and concern about how the pandemic was being managed in this state.
from the political leaders at the
right.
top.
Well, even how the Department of Health had to respond, based on what they were told by the political leaders at the top. You won't enforce isolation for people who are positive. You won't enforce quarantine. We won't necessarily worry about working too hard with schools to make sure that kids that were supposed to be in quarantine weren't attending school. The things that we would typically do as public health. If you get a case of measles, you go and isolate that person, you contact trace, you put those people in quarantine, and if they violate that, you go to court and you order them to be in quarantine or in isolation, because that's what stops the spread of this disease. In the case of COVID, even when case numbers were quite low, that was not the stance that the Department of Health was allowed to take. And so you saw this response, and it's the same response you kind of see all over the country now, which is quarantine and isolation seem to be kind of suggestions. And you hear all the time about people who know that they had a positive test or they have symptoms and they're waiting for a test, but they're out at the grocery store, or they sent their kids to ballet class or whatever. So it's a very different kind of approach than what we would typically take in an outbreak of a highly infectious disease.
Do you feel that at the health department that you had to do a political dance within the state of the politicians and citizens who were incredibly concerned, and some who thought, it's just the flu, and in many ways this is just
constantly. And we still do, and you see that with the school board arguments with the parents who want the mitigation strategies. They want their kids to be able to learn online. They want mask mandates in classes. They want teachers to have to be vaccinated, and then you have the parents who are screaming that their rights are being trod upon and kids can't be kids. The same thing, within public health, you see these political figures who are walking the line between, knowing what they need to do for the good of public health, but then knowing that at some point the citizens who elect them are going to get upset because they're putting in these restrictions.
Dr. Fiscus says the tension came to a head in Tennessee just as Pfizer was preparing to get approval for a COVID vaccine for children.
Tennessee is a state that has something called the mature minor doctrine, and this is a case law from Tennessee Supreme Court that came down in 1987, so it's been 34 years, that says that if you are a teenager age 14 and older in this state and your medical provider feels that you are mature enough to make the decision, that you are allowed to make your own healthcare decisions without the consent of your parents. And so all these providers were asking what they were supposed to do. I reached out to our legal counsel and asked them for the language explaining the mature minor doctrine. And I put that into a memo that I sent to these providers. And it made its way around social media, even though this was just sent to medical providers who are vaccinating, and into the hands of some of the anti-mask, anti-vaccine people who have the ear of several state legislators. And so on May 19th, they actually called for Department of Health to come and defend themselves for sending out this memo.
It's some type of legislative subcommittee.
That's right. So the Legislative Government Operations Committee that meets every month. And so they wanted us to come in and kind of defend why this memo was sent out. And then that got thrown out. They weren't allowed to discuss it because it wasn't on the agenda.
They ended up having the meeting on June 16th. While Dr. Fiscus and her family were on vacation in Alaska.
At that meeting of the Government Operations Committee, one of the legislators held up a Facebook ad that the governor's office had approved to put out with a picture of a teenager with a Band-Aid on her arm. And it just said, children 12 and older are eligible to get vaccinated, and mentioned the mature minor doctrine memo that I had sent out. And as a result of this, was so incensed that he actually called for the dismantling of the entire Department of Health in response to this. So when I came back from Alaska, I had chosen not to listen to the government ops meeting, but did listen to it when I came back the next week, and was really just amazed at the vitriol in that meeting.
Dr. Fiscus predicted one of two outcomes from the meeting. Either it would blow over or she would be fired. Some lawmakers were questioning a memo in which she had reminded people about a state law that already existed. But in subsequent months, it kept coming up over and over again.
I'm told by my boss and the chief medical officer of the state that writing's on the wall that I'm probably going to be terminated. And that when I asked for the reason was, well, the legislator's upset. The governor has to run for re-election, and the governor's office is pressing the commissioner, who also wants to run for office, that the way that we fix this is to fire you. My first response was, well, I'll resign before I allow you to fire me because, you're taught that it's bad to be fired. And then I thought about it for a day and said, no, never mind. I've not done anything wrong. I'm doing my job. I'm doing a darn good job. And so if you decide that you're going to fire me, then I guess that's the way this will go down. And it actually took a little over 2 weeks before that happened. So that was fun, to be packing up my office and kind of sitting every day wondering if, is today the day I'm going to get fired?
Then Dr. Fiscus got a text from her boss saying that they had a decision.
I was given the decision whether I wanted to sign a letter of resignation that they had written for me, or whether I wanted to sign a letter acknowledging that my executive service had expired. And so I read them both, and I decided to acknowledge the expiration of my executive service.
That seems like a kind of like a antiseptic way of saying you've been canned.
Yeah, you're fired.
Dr. Fiscus says she made a solid call based on existing state law, but she never thought that it would get the blowback that it did.
I fully expected to get hate mail or, trolled a lot on social media. I know there's social media stuff out there. My filters probably aren't allowing it to get to me. But I got a tremendous amount of support from within the department, from other states that had been dealing with the same kinds of issues, from my colleagues in pediatrics. When the doctors are on your side and backing you up, and the doctors have been calling for months for mask mandates and vaccinations to be promoted, and calling for people to do the right thing to protect our kids in schools. I'm good with that. I feel very confidently that I'm on the right side of history with this, and that it's just something that people needed to understand, that the people that they have elected have been obstructing the work of public health.
Some appointed and elected officials at the federal and state level have faced growing condemnation for decisions they've made during the pandemic. But as statewide public health mandates have dwindled, those choices increasingly fall to local government, city, county, and school board leaders. While Dr. Michelle Fiscus worked to define Tennessee's statewide COVID response, her husband, Brad, was serving a term on the Williamson County School Board. It's a school district that's made national news for demonstrations and arguments at school board meetings. That's where we started our story.
Deputy, can you please escort the man in the back out, please? Thank you, with the clipboard. Thank you.
Brad Fiscus, who spent over a decade as a public school teacher, was elected to serve on the board in 2018.
We started having discussions about what was going to happen come August of 2020 in April. The Tennessee School Board Association was trying to help us understand what our responsibilities were. And so then in July, the central office staff presented us a proposal. We didn't actually need to vote on it, but we did because we felt like it was important for us as elected officials to be the one to approve or deny it. And it was to require masks when we returned to school in August. So we started out the school year with masks. Our policy was that medical exemptions and religious exemptions would be allowed. And so we didn't have an overwhelming number of people who chose to take those exemptions. So we had a large number of people masking every day. And we were able to stay on campus for education for a good part of that year. Yes, we had pushback, but it wasn't to the level that we saw much later. And there was a man named Gary Humble who formed a group called Recall Williamson, mainly on social media, with the intent of pushing for a recall of those of us on the school board who voted for this back to school plan. And basically, it was every one of us, because that back to school plan in July of 2020 was voted, and it was a unanimous decision for us to return to school with masks on. But in Tennessee, there isn't a provision for a recall election for elected officials unless they've done something criminal. Is the only way you can really recall an elected official in Tennessee. So that situation, that movement, then morphed into another movement called Tennessee Stands, and which built steam and has a lot of energy now across Tennessee. And it became this organization where they said they were standing up for liberty, but really they're rallying against anyone who said that masks were necessary.
Brad Fiscus says Williamson County schools are top performers in the state, which makes the district a model. So anti-mask groups like Tennessee Stands hope to influence Williamson County in an effort to discourage mask requirements in schools across the state. Brad and I watched some of the video taken after the board passed the mask requirement. He was still in the building at the time.
The things that are going on here are making me absolutely crazy. We've lost all sensibility.
Have any of you ever mandated masks for the seasonal flu? Well, shame on you, because every kid in Williamson County schools has been under more danger from the seasonal flu every year than they are for COVID.
What was interesting is neither one of those are actually residents of Williamson County, and neither one of them have children in our school system. And they have traveled around to these different rallies. It's become, how do we get ourselves on the news? How do we try to incite this fear? The person that they were yelling at in the car was a person who had spoken during the meeting. He was misidentified as a doctor, as a physician. He's actually not. He does work for a hospital, but he's not a medical doctor.
What I hear them saying is like, we know who you are, right?
Yeah, it's like, we know who you are, we know where you live, you'll never be seen in public again. Those are threats. I mean, those are serious threats. And what was disappointing, and that it was that the Williamson County Sheriff, Franklin Police that were there that you saw in the video, that they didn't take a more proactive, they didn't actually step in a little bit earlier than that. And after that meeting and after that incident, they showed a much greater presence. They were much more involved in what was going on in the room as well, because there was concern that there could be carry out of those threats.
And the threats did continue. Multiple anonymous voicemails, heavily laced with insults, obscenities, and expletives. We listened to them together, and they made me wince. Brad gave us permission to use the demeaning material in our story. Ultimately, we chose to heavily edit the vulgar, offensive four-letter words from the hate-filled material because we don't want them to take center stage.
You know, Brad, you and your fat wife wouldn't have to be so worried about COVID if you hit the gym once a week. What kind of authority do you pigs have to try to tell people how to live their lives in a healthy fashion? Look at yourselves. You're both morbidly obese slobs. You can't manage your dumb wife with a strong pimp hand because you're a fat soy boy. Get the out of Tennessee, you pile of garbage.
How did you feel about that?
My husband has been the subject of scores of emails every day that have called him, an Antifa fascist, that have called him a Nazi, that, have told him that he's despicable. And then because I am who I am, they link the two of us quite often. So, it's not just him, but it's his wretched wife as well.
You guys are quite a pair.
We have quite the target on our backs. And so, when he gets messages like that, my first thought is, what a coward to call and leave a message like that, anonymously on his cell phone. We joked about, I wonder what would have happened if he'd picked up, would this person have even had the guts to say anything to him?
Well, and I think for me, in the situation that I was in with being the spouse of who I am, with in her role, they knew who she was. And so they were coming at me, those that were against masks, against vaccinating, whatever, they were coming at me already with vitriol. They were coming at me already with accusations. But the reality is, and it's this idea that the loudest voices are the majority. But I was hearing from parents of kids who might have immune compromising health situations, just parents of kids who said, we want our children masked. We want our kids to be safe while they're at school. Please make sure there's a mask mandate. But you couldn't really have a civil conversation with the group of people who were behaving like that at the meeting in more than a one-to-one talk. Like you could have conversation one-to-one with them, but at some point the name calling, the accusations, the vitriol would start to be unleashed.
Brad Fiskus decided to resign from his school board position last fall. Since then, some states report an unprecedented number of such resignations, while others see a significant increase in the number of recall petitions against sitting school board members. Last fall, Brad and Michelle Fiskus also decided to leave Tennessee, their home for more than 20 years. They raised their children there and both served their community. But now they say they no longer know the community or feel a part of it.
Leaving was really hard. I was walking through the house doing what we call an idiot check, making sure that we hadn't left anything. And I just lost it. And I came down the stairs, and my husband and my daughter were there, and I said, if I had just kept my mouth shut, if I had just tucked tail and walked away like they wanted me to, we wouldn't be going through this. And they said, you had to, you didn't have a choice but to do this. And so in some ways, I feel like we quit. We gave up. We said we're done. And I feel badly about that, because if all the good people who stand up for the right things leave like we did, then things just get worse and worse. At the same time, it's important to take care of your own mental health and your own needs. And we had really come to that place. And so the decision to leave, I don't think was tucking tail and running. It was prioritizing our own needs ahead of continuing to fight in that community.
Part of what I believe is that we're to do all the good you can in all the places you can, and to be in love with God and to do no harm. And Jesus reminded us and added to it in the New Testament that we are to love our neighbors as ourselves. And so by doing that, by in this case in the pandemic, by following science, by saying yes, we're gonna require masks, that's helping to promote the love of neighbor, because my decision to wear a mask is not about protecting me, it's about protecting you, right?
I don't know how it gets better. I don't know how long it takes to heal from this. And I think all of that's just very, very unsettling.
Remember the survey that I mentioned earlier, the one from the National League of Cities? It reported more than 80% of local leaders have been harassed, threatened, or experienced violence recently. That survey also asked people how being targeted has changed them. According to the National League of Cities, some local officials say they don't want to pick up the phone or open their emails because they're afraid of the hate they might receive. They are afraid to do their job. And they say this harassment has a budgetary impact on cities. They must hire extra security, install ballistic glass, and develop safety protocols. When we come back after a break, we'll hear from some people that I spoke with on my travels across the South. I asked people how local mandates have changed their communities, their neighborhoods, and their lives. I'm Trey Kay, and this is Us and Them. Our show is supported in part by the West Virginia Humanities Council and the CRC Foundation.
Music lifts us up and brings us together, even when we can't get together in person. Mountain Stage brings you live performances on the air, online, and in our podcast. They remind you how it feels to be in a live audience listening to live music. This is Larry Gross, host of Mountain Stage. Find a link to our stations and our podcast online at mountainstage.org.
Portions of this episode contain strong and offensive language. It may not be suitable for all listeners. I'm Trey Kay, and you're listening to Us and Them from PRX and West Virginia Public Broadcasting. My friend Alice Moore helped me learn about how contentious local elected government can be. When I was just a kid, she was on the school board where I grew up in Kanawha County, West Virginia. She served when a controversy erupted in the 1970s over new textbooks. The books were designed to reflect America's multicultural society, but some felt they undermined traditional American values. I met Alice years later when I was reporting on that controversy. When I visited her recently in Tennessee, our conversation, as per usual, took many turns, from the last election to race and, of course, vaccines.
When you were the head of the school board, were you nervous about kids having to get the measles and the various other vaccinations to get into school in West Virginia?
My children had all the vaccinations that they had years ago, the shots that had been tested for a long period of time. And of course, they took those. And then David, before he could go to school, they said he had to have smallpox vaccination. And he had granulated eyelids, which, that develop sometimes if they have vision problems, vision problems. So I told the doctor I don't want him to have smallpox vaccination and take the chance that he could get, this infection from this vaccination could get in his eyes and cause him to have vision problems. So I just said, no, he's not going to get that. And they were telling me he had to have it, and I just said, no, he's not going to have it. I'm not going to let him have that vaccination. And so he never got it, and because David never got it then, Kevin and Amy never got it because they were, and Timothy never had it because they were all younger than him. And by that time, they had done away with smallpox vaccinations, so they just never had it.
Most parents do what they feel is best for their kids. And from the parents I've spoken to, no one wants to be told how to raise their child, let alone what health care should be provided. When I was in Tennessee, I spoke with Dale Brown, a licensed chiropractor. He's very vocal on social media against the COVID-19 vaccine. Public health officials recommend the vaccine and boosters for nearly everyone. However, Brown is clear about what motivates his opinions and decisions.
My motivation is not from my chiropractic. My information is because I can read. It is because I love my children. It's because I want best for my children. So I'm doing that out of the love of a father for my children and for other children is why I'm bringing this information.
I had to ask Brown, was it just the COVID vaccine he was wary of? or was it all vaccines?
If I was 100% honest, even before this, the decision has always been, will always be, there's no way that I'll be vaccinated. I would ever accept it. I would defend myself. I would defend my family if we needed to, God forbid. The major pivotal point for me, recognizing what pharmaceutical industries engage in their marketing practice and their illegal practices, came from pharmaceutical drugs. Like vaccines was a component. They've committed fraud when it comes to vaccines, one of the most recent situations with the dengue vaccine. So we know this industry is willing to lie about the safety and effectiveness of their interventions, their drugs or their vaccines. And we know that by court cases, and they've been proven to have lied, withheld evidence that knew that people would die, that more people would die if they gave that intervention, that drug or that vaccine.
Back in 2009, Pfizer Incorporated and its subsidiary agreed to pay $2.3 billion, the largest healthcare fraud settlement in the history of the Justice Department. The settlement was over criminal and civil liability from the illegal promotion of certain pharmaceutical products. However, that case was unrelated to the dengue fever vaccine.
It's very difficult to regain trust after that industry has repetitively shown itself to be willing to put profits in the place at a higher, desire for them than saving the lives of people.
I asked Brown about his children. Are they vaccinated?
They're completely unvaccinated. Not a single one of them have ever had a single medication in their life. And they don't have allergies, asthma, eczema, ADHD, ADD. They don't have what oftentimes 1 in 5 American children now are dealing with chronic illnesses. They don't have any of those.
Brown says he tries to focus on natural and herbal-based ways to support his family's immune system. He admits that legally he cannot say they are treatments for COVID, but he believes that having a healthy body is important.
I have to say, I was in a kind of a tough, bar down in South Carolina a few weeks ago, and people are smoking and drinking and don't want to wear a mask, and I'm not going to take that damn vaccine. And I'm not exactly sure that you and your health care regime is the same as theirs. And I'm not exactly sure that that was an environment where people were being incredibly safe and conscious and public-minded with regard to a global pandemic.
The argument that it's a public, because you said public health good. A public health good would be shutting down McDonald's and Wendy's and fast food restaurants, or at least forcing them to do what other countries have done, where it has to be natural vinegar and tomato sauce, not all the other crap and sugar that's in there. That would be public health, not a vaccine that can't prevent transmission or infection. That is not beneficial for anyone. At best, they would argue that the vaccine promotes a prior immunity so that when they catch the virus, they would have less severe illness.
Dale Brown is very aware of Michelle and Brad Fiscus and what happened to them. He's seen the fights and arguments that break out over vaccine mandates.
One of the frustrations I have, even with what many would refer to as the anti-vaccination movement, is, and this is something that I've had to seek and work on myself in my own spirit. That's why I didn't go after and publicize Fiscus is fired. Yay, root, root. I tried not to do that. I tried not to attack an individual. I used to do that a little bit, and I would say I'm sorry. And so while I may have slipped up out of frustration or, out of human emotion, I may have said things in the past. I bet we could find it on my Facebook at some point in the past years.
There was a time when Brown did ask Brad Fiscus if he wanted to sit down and have a conversation with him. But Fiscus said at the time he wasn't interested.
It would have just given him a platform to continue promoting more misinformation about vaccines. And in that message that Dr. Brown sent to me, he said, if you're truly a follower of Jesus, then you should be concerned about the harm being done to children. And that was another part of this pandemic that came out, that if we made choices that were science-based, then we must not be followers of Jesus Christ. We must be anti-Christian, and that We must not care about the harm being done to kids.
Traveling across the South, I talked with a lot of different people. Bar owners, drivers, poets, and preachers. And each person has their own reasons for either getting vaccinated or not.
My name is Dan. I have a small business that is photography oriented, and I do Lyft driving as a supplemental source of income.
And how has the COVID pandemic been for you here in Charleston, South Carolina?
We have a big food scene. I know restaurants are a challenging business, and certainly we've lost some restaurants, but I've positioned myself to where I can continue to pay my bills and make ends meet until we can rise past this challenge that we're facing.
How about the vaccination? What are your thoughts on that?
I'm fine with the vaccine. We have to get vaccinated. You know, we've had to show vaccines or vaccination since we've been children going to school. I understand that there's some people that are a little bit hesitant waiting for the FDA to formally clear it. It'll be interesting to see if those people will get vaccinated after the FDA has cleared it. I don't feel like we can economically recover until we suppress this pandemic.
To me, it seems as though a lot of this pandemic, whether you think it's for real or not, or whether you choose to wear a mask or not, or whether you choose to get vaccinated or not, it seems to break down on political lines.
We are in a very divided country, and I think we work better when we follow what our country's laid out for a path to do. And it seems like rules and things don't apply anymore as long as you get what you want. We live in a country that's very complicated. I don't think adding more toxic elements to what's going on in our country is going to move us forward. We have real challenges facing this world, and they're all coming together simultaneously. I don't feel like we invest in our country much anymore. I think we take as much as we can for ourselves and try not to invest much back into it. I don't understand why our last president, who was very excited about this warp speed vaccine development, but then chose to get vaccinated in the privacy of the White House. It seems bizarre to me. I don't know why you wouldn't, if you've done something so great, not continue to promote it. It seems counterintuitive to me.
Dan says a friend of his was taking a drug used by veterinarians to treat parasitic infections in animals as an alternative to prevent COVID. It can cause severe health issues in adults and result in coma and even death. Dan says he doesn't understand the desire to listen to Facebook over medical doctors.
Doctors have to go through 10 years of education, spend probably $250,000 to become a doctor, but we don't need to listen to them. We need to listen to someone on Facebook telling us that, products used in livestock are going to get rid of their COVID. It seems bizarre to me.
Dan says his parents instilled in him an understanding of the greater good. He says it's an awareness of a time when the country needs to come together, and people must act for the greater good of everyone, rather than prioritizing individual rights.
I think capitalism's healthy, but, you always hear people talk about addicts, but I've noticed in our country that we have addicts that are addicted to money. Kennedy that said, not what your country can do for you, but what can you do for your country? I mean, we've kind of lost sight of that.
I also met with Patrick Hancock while in South Carolina. He owns the Heroes Pub in the town of Goose Creek. It's a popular place where local people gather together to drink and smoke and engage in lively conversation over the crack of pool balls and jukebox music. The place has a patriotic vibe with many American flags draped on the walls. There are other flags too, like the Gadsden flag. You know, the one with the coiled rattlesnake and the words, "Don't tread on me." And the Confederate battle flag is also prominently displayed. I interviewed Patrick back in 2017, just a few days before Donald Trump was inaugurated. We've stayed in touch, and Patrick's business suffered a lot last year, especially after a 6-week shutdown from mid-March to early June.
I did the best thing I could do for my employees. I kept them working. We ripped up all the old carpet. Notice it don't stink in here anymore from the 30-year-old carpet. We washed all the walls in here. You see all the camouflage all over the walls? That's because I had every volunteer that wanted to come around, and we painted all the walls. We changed out ceiling tiles. We changed the motif. We painted the bathrooms. And if they were wanting to come, everybody could come, and I was paying them $15 an hour. Wrote them a check for $15 an hour.
Patrick Hancock paid out $56,000 from his pocket for the improvements to his bar. He's proud that he didn't have to fire one employee, unlike many other restaurant owners in his area. Patrick didn't want his employees and other people in his community to have to turn to social welfare programs. Patrick, like many people, thought these shutdowns would only last a few weeks, and he was positive that he'd reopen soon. When Patrick's bar was allowed to reopen in June, he had new restrictions he had to deal with.
My license says I can be open till 2. They say, well, you got to stop serving alcohol at 11 or 10 or whatever their arbitrary damn number was. And if all those people wanted to stay in here and play pool, play darts, listen to live music, whatever, they could do it. No mask on, but you couldn't serve alcohol after that.
If they had the mask mandates here or whatever, when they did you comply with all that?
No. It was the dumbest thing in the world. What's going to change the difference? A person walks in the door. Here was what their mask mandate was. A person walks in the door. They've got to have their mask on until they come in and sit down. They got to go to the bathroom. They got to put their mask back on, go to the bathroom, come back, sit down. Doesn't matter the proximity to somebody else.
Did you have people coming in and saying, we're going to fine you because you don't have masks?
No, Charleston County wasn't that way. Charleston County got, I mean, they created, that's a bureaucracy. That's one of those Democrat strongholds.
Charleston County is where Charleston is. We're in Berkeley County now, which is
northeast, I guess you'd say. The Charleston County developed its, again, it's a Democrat stronghold. What was the first thing they're going to do? They developed this entire office of little snitches, is basically what it was. And those people's job was to ride around, sneaking around in parking lots, looking in the windows and seeing people working without a mask on. I don't believe in masks.
Why not?
What I believe is the natural way God made us to be. If you're spitting on me, you got spittle coming, and you're not feeling good, by all means, man, cover yourself up. You can't bully me. Matter of fact, the more you try to bully me, if you'd have just said, listen, man, this thing's killing people, and it was serious, and the numbers matched the bullshit that they were throwing out there, I want to know about how many people are dying from it, because the percentage of people that die from the flu is probably more than that.
Patrick sees mask mandates as a form of bullying, but he acknowledges that safety rules are essential in the food industry.
I don't put my hands to my face because I grew up working in a Waffle House restaurant where you're cooking in front of 30 people at one time. You don't touch your face, you don't touch your butt, you don't put your hands in your pocket, you don't grab on your you just don't. And you got to have rules.
Patrick is not convinced COVID is that serious. But according to the Centers for Disease Control, in 2020, COVID was the third leading cause of death in the U.S. after heart disease and cancer. So far in 2021, more than 353,000 people have already died from COVID. That's more than last year. And that's despite the fact that we have 3 vaccines available to the public.
Everybody dies of something, Bo. Everybody got to die sometime. Hey, do you want to live your life in fear? Do you want to live it as a sheep, or do you want to live as a lion? I choose to live my life in faith and as a lion. I don't want to be a sheep. If I'm going to die, let me die on a field with some honor. Let me die defending a woman's honor that I've never met before just because I wouldn't let her get beat to death in public. Let me die defending a right. Oh, please. I stood up for something.
For many people I talked with during my travels, faith seems to play a large role. And after all these conversations, I realized there is a lot of tension in the air about the range of issues facing Americans today. Few people feel very confident about the future of our country. So I turned to someone I've spoken to often before, Reverend Ronald English. He's a former pastor and was a family friend of Martin Luther King Jr. I caught up with him back in my hometown of Charleston, West Virginia, to talk about where things stand, about masks, vaccines, and other things that divide us.
The division between us makes us our own worst enemy. And therefore, situations like this have the tendency to draw us together, or people together, and really search for that common ground. Because the common ground is somewhere between dark and light.
That's so true. And reminds me of what's important. In talking with people, I listen and learn. And that helps me discover some common ground. You're listening to Us and Them. Our team for this show was me, Trey Kay, Samantha Gatzik, Brad Stratton, and Kate Smith. Special thanks to our friends Anita Bugg, Tony Gonzalez, Paige Flager, and Blake Farmer at WPLN, Nashville Public Radio. Michael Lipton and Tristam Lozow wrote and performed the Us and Them show music. Mark Lerner designed our logo. Lelena Price provides us with images for the web. And Jane Sears Wright does the invaluable work of securing our funding. The marvelous people at PRX and West Virginia Public Broadcasting make Us and Them possible. So do grants from the Corporation for Public Broadcasting, the West Virginia Humanities Council, and the CRC Foundation. Us and Them was originally developed with assistance from the Mentorship Program at AIR, the Association of Independents in Radio. We'll see you next time on Us and Them.
Support for this podcast comes from the Corporation for Public Broadcasting.